and we are going to be talking all about postpartum care for parents today. So, of course, we're going to be doing a giveaway as always. So, if you're interested in winning a knitted baby blanket, a musical learning book, and a signed Common Sense Parenting book from our friends at Boys Town Common Sense Parenting, make sure you like this video and leave a comment below to be entered, and we'll go through our discussion. But before we do that, Dr. Zimmer, would you please introduce yourself and tell us about your time at Boys Town Pediatrics?
Sure. So I'm Annie Zimmer. I'm a general pediatrician at the Pacific Street location for Boys Town, and I've been at this location, I think, 8 or 9 years. And I see newborns up to, early 20s, and would be happy to meet with anybody. Any of my partners would be happy to meet with parents, and all of our Boys Town pediatricians do meet the doc. So feel free to meet or set up a meet the doc and get to know somebody and make sure you find a good fit for you. So
yeah, definitely. And of course, we'll have the free meet and greet form to fill out linked in our comment section of this video at the end, where we link all of our other resources as well. So as mentioned today, we're talking about postpartum care for parents. And our first discussion question, Dr. Zimmer, is what role does a pediatrician play in supporting parents post-birth?
Yeah, us as pediatricians, we're very interested in helping you as a new parent. It's a big adventure. It's one of the most changing things that's going to happen to you. So we are really there to support you. Medically, we're the baby's doctor. So you might have to go to your own obstetrician to get medical care. But if you have questions, we're happy to answer them. And if you're struggling, we want to hear about it. So we have some resources that we can provide sometimes, or ideas, or help you know what's normal and what's not normal, and when you need to ask for more help. So, but we're definitely there to make sure that your baby is doing well and there's no health concerns there too.
Definitely. What are some signs of postpartum depression that parents should watch for?
The symptoms of depression are the same postpartum as they are for any other time in your life. So low, not sleeping well, not eating well, low energy, but that can all be part of being a new parent and your schedule is a mess and you aren't getting good sleep. But bigger clues might be if you're not enjoying this new adventure as much as you thought you would, if you find yourself crying a lot or just unhappy, if people invite you to do something that you would normally love to do and you just don't care. If you go, if you're having a lot of those kind of feelings or feeling worthless or hopeless, absolutely, I would be concerned that maybe you're getting a little depressed. And I think along those same lines, anxiety is too. So if you just find yourself, you can't shut your brain off, you're just worrying about things that aren't even going to happen. A lot of the time, that's probably cause for concern too.
Definitely. And what is the difference between the baby blues and postpartum depression?
So baby blues is a common thing that hormones of having a baby, especially for women, but also, even if you didn't have the baby yourself, dads or moms that weren't able to carry the baby, you can have a change in your mood. And it's just kind of the different changes in your life, in your routine, and the expectations kind of getting reset after a baby shows up. And that's common around 2 weeks of age. But it shouldn't be so severe that you're feeling hopeless or worthless and those kind of feelings. So if it's prolonged or more severe, then I would be concerned that it's depression.
Yeah. Wonderful. Let's talk about mental health. In your expert opinion, how can parents prioritize their mental health after birth?
I think when you have a new baby, it's very tempting to just want to be there and do everything for the baby. And you get a little bit of FOMO even, that you can't be without the baby. And there's a lot of people in your life, whether it's your partner or if you don't have a partner, if it's an extended family member or a close friend, that want to help you out and would probably love to babysit your baby or watch the baby for an hour while you go take a shower and read a book or take a nap or something like that. So letting people help you, I think, is a good thing to help prioritize your well-being.
Yeah, we talk so much at Boys Town, it takes a village, and we're a Boys Town village, so you can definitely lean on us and lean on your pediatrician,
Yes.
as well as our 24-hour nurse helpline. And, we think so much, I think, when we talk about postpartum care for parents, most people, correct me if I'm wrong, have usually 1 or 2 follow-ups with their OB, right? And then you're with your pediatrician from birth all the way until your kid is, well into college. So,
Yeah.
um,
Yeah. And I always, when my patients leave, I always tell them, okay, we need to see you by this time, but especially in those first few weeks, I say we might see you before then if you have concerns, because if you're worried, we want to make sure that there's nothing to worry about and give you that appropriate reassurance or investigate if it is actually worrisome. So
yeah, for sure. Let's talk sleep. So, what sleep strategies can help new parents manage exhaustion? We hear a lot, sleep when the baby sleeps. Is that advice that you would recommend?
I do recommend that. I know it's not gonna happen. And sometimes it feels like the baby never actually sleeps, or the baby doesn't sleep unless I'm awake holding the baby. But some advice that I got when I started residency, which is a notoriously sleepless spell of your life too, it's different than having a baby. A baby is like a chronic sleep deprivation, but we were really encouraged to think of it as a bank. And so even 15 minutes can be very refreshing, and that's not ideal sleep, but just helping get some sleep in small increments can be helpful. So I remember as a new mom, it was really tempting to catch up on emails or get something done when the baby was sleeping, but actually letting yourself sleep, even if it's going to be only 20 minutes before that baby's going to wake up and want to be fed again or something like that, it still adds up. So small amounts of sleep. And then the other strategy is, if you have a partner, kind of setting aside shifts that you protect each other's sleep. So if you have more energy for the baby in the morning and your partner has more energy in the evening, maybe there's some time that you can kind of protect each other's sleep and take on more responsibility for the baby so that the other one can be sleeping.
Definitely. What resources are available for parents who are struggling with their mental health postpartum?
Yeah, so your pediatrician can be a resource for you if you need prescriptions. We're going to probably encourage you to talk to your obstetrician, and maybe you're more comfortable talking to your obstetrician, and that's 100% appropriate. We're all very tuned into it, both on the obstetric side and the pediatric side, and we want to be helpful. There are some postpartum groups around town through the hospitals. I know there's one at Nebraska Medicine and there's one at Methodist. They're monthly, but they're really positive for new moms or even expectant moms, just to talk to other moms that are struggling with some of the same things. And it doesn't have to be mental health related, but just it's a really positive support. And then there's a lot of therapists and counselors around town too, which we can help point you to, but there's a lot of places online that specifically do postpartum care.
Yeah. How soon should parents schedule their first postpartum visit with their pediatrician?
Yeah, so there's a good chance that your pediatrician will see your baby in the hospital, or at least somebody from their group will, and they will tell you for sure when the baby should be seen. Whatever doctor is seeing your baby in the hospital should give you some advice about how soon your baby should follow up. Your baby might have more risk from their hospital stay that might be sooner, but typically every baby's going to be seen within 1 to 3 days of being discharged. So plan on a not too long of a leash when you get discharged from the hospital, because we're going to want to see you and check in and make sure baby's doing well.
And we had a question earlier this week via DM asking about the meet and greets, or getting started with a pediatrician. They asked, I'm expecting baby. Do I need to wait until after I give birth to get set up with a pediatrician, or how early in my pregnancy can I do that? Is there a time?
Yeah, you can do it anytime. I usually keep a note, and sometimes it's been 6 months since I've seen the mom, and then they're in the hospital and I see them again. So it can be very early in your pregnancy, and that is 100% okay. And we do sometimes do them after delivery, but your baby's gonna need to see somebody. And if your baby needs seen, that won't be a meet the doc, that'll be an actual doctor visit, but it's still non-committal. Like if you found a pediatrician and you didn't like them, you can always shop for the next one. We just don't want you to fall behind on getting your baby checked out when they need checked out.
Yeah, perfect. And with our meet and greets too, we also do them virtually. So if you like these virtual seminars we've been doing, you can kind of shop around, like Dr. Zimmer said, and do a few meet and greets with several different pediatricians at Boys Town to find one that fits your family. All right, we just have a few more questions here on our list. So if you're watching live and you have a question on postpartum care for parents, or really any of the topics that we've discussed this week, go ahead and leave them in the comments for Dr. Zimmer and we can answer them. Okay, what physical recovery tips do you recommend for new mothers?
Yeah, I think, you still want to prioritize good, healthy decisions. I think it's a good time in your life to treat yourself a little bit too, and, maybe eat some chocolate that you might not normally eat, but making sure you're hydrated, making sure you are eating fruits and vegetables, make sure that you get outside and go for a walk when you can, whether it's with the baby or, during your carved out me time that your partner's supporting or something like that. Or even if it's 30 minutes, like going down in the basement and reading a book, or doing a little online workout or something like that to keep your body moving and your mind kind of fresh, I think is really important. Like I said, it's a good time to treat yourself. And if you can treat yourself to something that is a positive, like getting a new water bottle that you kind of were holding off on to motivate you to stay hydrated, or getting a new sheets or something to motivate you to get good sleep or something like that. So
we can never have too many water bottles, right?
I know. That seems to be the thing, right?
Yes. Awesome. And then, with balancing self-care while caring for a newborn, I love some of the ideas that you said, and definitely lean on your village. I want to echo that again. And the big theme of this week, with all the tips that we're providing, is call your pediatrician. So within your village, we are very much part of that. And between our pediatricians, our nurse line, and boystownpediatrics.org, and Same Day Pediatrics, where you can get a same-day sick visit, we are here to kind of help you and your family not only care for the baby, but your family as a whole. So I just want to mention that one more time.
100%. Where you're not going to be the first person to ever call the doctor, that's for sure. So don't be shy calling the doctor if you have concerns.
No concern is too small.
Right.
And then lastly, do you have any more community support groups or services that you recommend? I know you talked about, some of those mom or parenting groups that are available, but any more?
Another resource I think, or a point of stress for a lot of moms, is if they're breastfeeding. And there's a lot of lactation support that can be provided through your insurance or even on a sliding scale. But I think that's a source of a lot of stress for moms, and meeting with the lactation specialist can be really helpful to let you know that your struggle is real and normal, and nothing's, you're doing the right things, or giving you tips to help it go better. So I wouldn't be shy utilizing those resources as well.
Mm-hmm. Yeah, we talked yesterday with Dr. Emson on feeding, and one of the myths she dispelled was, breastfeeding is natural and easy and comes, very easy for some. And for some, yeah, that might be true, but never feel discouraged if it's something that, you need help with.
Yep. It's a struggle for most women to some extent, so it deserves a little extra attention.
Yes, wonderful. All right, so before we spin our giveaway wheel, I want to mention too that we do have our in-person newborn care workshop coming up this Saturday, and we hope to see many of you there who have been tuning in all week. And I'll make sure to link the details of that, and you should get an email as well for location, time. I believe yesterday we sent over the agenda of events that you can look forward to, so hope to see you all there. All right, and the giveaway winner for today is going to be Tiffany M. Congrats, Tiffany. We will send you a message from the page to organize claiming your prize. And thank you everyone for watching. Of course, we're doing the master giveaway here. We'll probably do it at the end of the weekend, and that is going to be a newborn photo shoot with our friend Nikki McLay Photography. Dr. Zimmer, thank you so much for joining us.
Absolutely. Thanks for your patience, everyone.
Yes, thank you so much. And we will be live for our last one tomorrow with Dr. John Vanderhoof on fussy baby tips. He is a pediatric gastroenterologist at Boys Town, and we look forward to sharing more with you then. Thanks, everyone.